Every year, nearly 500,000 Americans are diagnosed with heart failure. It's a condition that results in your heart not being able to pump blood efficiently. Most cases are caused by coronary artery disease or years of high blood pressure. But the woman you're about to meet had heart failure for a very different reason. A common virus, likely a cold or flu, attacked her heart and nearly took her life. More from Mayo Clinic. Crystal Valles remembers very well the shock of what doctors told her in the emergency room.
You go from thinking you're just sick with the flu to them telling you you're in heart failure.
After that, it was all a blur, a bad dream, a nightmare.
They even came in and said, you know, that I better make sure that all my goodbyes were said.
But there was no time for Crystal to say goodbye to her daughter Julia because she needed intervention fast. Crystal had a rare form of heart failure called lymphocytic myocarditis.
Sometimes certain viruses can attack the heart muscle, and those individuals can be quite challenging to care for because they can be extremely ill.
Dr. Robert Scott says the virus caused inflammation in Crystal's heart muscle. The inflammation prevented her heart from pumping efficiently. Doctors implanted an intra-aortic balloon pump to keep her alive until medication got the inflammation under control.
3, 4, keep your back straight, 1.
Within a couple of weeks, Crystal went from being gravely ill to being able to coach her daughter on the dance floor, thanks in part to prompt treatment.
The prognosis in heart failure gets better the earlier you start treatment.
So if you have symptoms that include shortness of breath, fatigue, and a general feeling of being unwell, especially if they're in conjunction with a cold or flu, see your doctor. Crystal knows it's a trip that could save your life. Dr. Scott says Crystal's heart made a full recovery. Typical heart failure comes on slowly, and the faster you get treatment for it, the healthier you will be. For Medical Edge, I'm Vivien Williams.